Welcome. It is my great pleasure to welcome you to the inaugural Research Symposium for the Maternal and Child Health Research Institute. My name is Mary Leonard. I'm chair of the Department of Pediatrics and director of the Research Institute. First, we're so pleased to unveil our new name. Many of you know us as the Child Health Research Institute, but when we created our new logo, one of our maternal fetal medicine colleagues said, well, at least the mother's in the logo. And I said, oh, we can fix that. So with the approval of the governing board, we changed our name just a few weeks ago to reflect the fact that we've always had a deep commitment to maternal health. So the Child Health, or the Maternal and Child Health Research Institute, was founded 10 years ago, and at that time our mission was to marshal all disciplines at Stanford to launch healthier lives. And I think that's actually so nicely aligned with the recent priority from the Integrated Strategic Plan across the two hospitals and the School of Medicine to really highlight and to leverage that, which is uniquely Stanford. So how have we done this? Well, we've really focused on creating a community. We're very proud that we now have over 500 members of the Research Institute representing all of the basic science and the clinical departments here in the School of Medicine, but also faculty from the School of Engineering, the School of Law, the Humanities and the Sciences, the Earth Sciences. At this point, if we can get a member from the business school, we'll have all 7 schools represented. So today's event, I think, is an extraordinary opportunity to showcase all of the work that we've been doing across the spectrum of work that's been happening across the campus. But most importantly, this is an opportunity for you to meet each other, to learn about what we're doing, to network, to collaborate. And we really hope that by this time next year, we will have funded some grants that were inspired and really sparked by today's event. So just to say a little bit about the event, we had over 400 people who've registered, 127 posters, and our Eureka alumni, very a young, energetic, visionary group, have put together a speed dating event at the end of the day. And so much of what we're going to tell you about today are based on the grants that have been given out by the Research Institute over the last few years. So how do we pursue our mission? We really have about 3 broad categories of the things we do. The first is the grants that we give out. In the last year alone, we gave out 111 grants totaling over $8.8 million. These grants focus on training the next generation. There's a very big focus on training the next generation. We give out seed grants to all of any of our investigators are eligible, even most senior investigators, to take their research into a new direction. One of the most remarkable things we do, I think, is our transdisciplinary partnership, which requires that one of the PIs be from outside the School of Medicine. In many ways, that's how the magic happens. Whether it's an engineer who helps us measure the mechanical stress that a telomere is under, or somebody in general pediatrics who works with the policy lab to look at the impact of immigrant policies on on children and mothers, or somebody who works with the School of Education to do a texting intervention to improve literacy in our really high-risk youth who are healthy but not thriving. So really encourage you to go onto our website and take a look at all of the grants that we've funded, and I hope we'll find them as inspiring as we do. We also have bridge grants. We have supplemental grants for people on NIH Career Development Awards. And this year, the executive committee really has put a great deal of emphasis on funding postdocs. We're actually going to give out $2.4 million in postdoc awards, because what we're really trying to do is increase our reach, increase our impact, and get the investigators on all the labs across this campus to think about how they might turn the lens and focus on maternal and child health research. Other things that we do are increased infrastructure to support research, whether it's the Clinical Research Support Office, Biostatistics and Data Management Core, or other resources that are available to our investigators, all focusing on accelerating the research, helping get you out of some of the red tape, overcoming some of the barriers that can be problems as we try to translate from our fundamental discoveries to patient care and to policy. Another focus has been our global, increasing our reach into other strengths on this campus. So we now fund through partnerships with the Center for Innovation in Global Health, the Undiagnosed Disease Network, the Diabetes Research Center, as well as all of the institutes that are on campus in the School of Medicine and Spark. You can't begin to thank the people who make that possible. If you think about giving out 111 grants, you can only imagine how many grants we reviewed. We have 10 standing panels of reviewer. We have 78 faculty that help us do all of these grants, all the review that's really needed to demonstrate that we have really a strong peer-reviewed system and funding the very best that we have here at Stanford. And you can also imagine the administrative firepower that it takes to make that happen. And we have really many people to thank. I, in all my career, have never worked with a team that is as professional, thoughtful, conscientious, creative, visionary as the group that supports this research institute. So a special thanks to Mary, to Grant, to Hosna, to Roxana, to Ken, and to Carol, and to the many volunteers who came to this event today and made this possible. So another foundational piece of the Maternal and Child Health Research Institute is the Lucile Packard Foundation for Children's Health. So as you're going to hear, they've just been instrumental through endowments and other mechanisms to fund everything that you're going to hear about, as well as very generous support from the hospital. So on that note, another first today is I'm so excited to introduce Cynthia Brandt. Cynthia is the new president and CEO of Lucile Packard Foundation for Child Health, for Children's Health, which has been so important to the Research Institute. Cynthia brings more than 20 years of experience in fundraising and campaign leadership. She came to us from the Smithsonian, where she led a campaign that raised nearly $2 billion in record time, coming in well ahead of their target date. So, in many ways, this is a homecoming for Cynthia, who did her master's and PhD in sociology here at Stanford and was the associate dean for external relations at Stanford School of Humanities and Sciences. I think when you hear Cynthia speak, and as you have the pleasure of working with her, it will feel as if her lifelong mission has been to support research and the mission of children's health. Cynthia, welcome.
I wanted to give Mary a high five there. I mean, what an awesome day. What an awesome gathering. By far, this is the most exciting place to be on campus today, right? We are united around a shared purpose. This is all about doing the most promising research, bringing together the most brilliant physician scientists, and pushing forward the research that can have the greatest impact for all of the moms and babies and families that we are working towards helping. So I want to thank you for being here, for joining us. As Mary said, my name is Cynthia Brandt, and I've joined the foundation whose sole job, our only job, is to raise money to support the work that you do and that happens at the Packard Hospital. Now, in fundraising, we're always looking for tools. How do we do this work? And storytelling is our number one tool. And I want to tell you a brief story. So I've just been here 2 months. And even before I started, I came to an event at the hospital, and this was to recognize some donors who made really amazing gifts there. It was such a fun, motivating, inspiring event. Part of what made it so exciting is that we heard from the mom of one of our patients. This is a now 6-year-old boy named Tyler. His mom tells us this story of how he's born, in her words, with half a heart. And he has had 3 open heart surgeries at Packard, and he's really doing well. I mean, she has this incredible story of hope and optimism. At the same time, she recognizes, this is a lifelong battle for him and for their family. So we leave with this message of hope and optimism and also a drive. We are not done. Then, fast forward, weeks and weeks that I've been here, I meet the folks at the Moore Heart Center, including Dr. Marlene Rabinovich. And they tell me about how basic science is how we are going to be able to deal with pediatric heart disease in a way that hopefully makes those kind of surgeries obsolete. Again, total hope based on research. So what do I take from that kind of story? What is it I try to convey on your behalf? Again, this pride and a sense of we have so much more to do. Now, 2 things that Dr. Leonard has taught me and my team is that about pediatric research is first, that funding for this kind of work lags way behind funding for the research for adult medicine. 10% of NIH funding. That is infuriating. We cannot let money be the thing that holds us back from making progress, from funding the work you do, from translating that into clinical settings. The second thing that I'm learning is how much this kind of work requires risk and an appetite for trying new things, even when we don't know what will work out. So that's, to me, where philanthropy comes in. That's the lever we can push. And I just want to leave you with a sense of the team that is behind you working towards this kind of lever, this kind of funding. So first, the team at the foundation, we're invisible. You do not see us, but I assure you there are a bunch of us here today, and we think about your work every single day, trying to figure out, how do we tell the story? How do we reach the right people who have the means and the motivation to help support this work? All right, in addition to staff, we have thousands of donors who have made gifts, and I'm talking about gifts from like $10 up to $10 million to support the MCHRI over years, something like $16 million that has come in small and medium-sized gifts over the past decade, all to support this kind of high-risk, high-lever work that you're doing. We also have donors that I want to recognize who've made huge transformative gifts, and in particular here, I want to call out Bob and Ann Bass, John and Tasha Morgridge. Many of you recognize these names because these folks have endowed more than 30 fellowships for faculty, scholars, and fellowships given through the MCHRI. They are making this possible. I also want to say we have a number of volunteer leaders. Some of our board members and donors are here today, again, to learn about your science and even more to learn how we can represent the science and ultimately how we can partner better with all of you in telling those stories. So I want to thank you, Dr. Leonard, Dean Miner, Dr. Oro. Thank you for including us at the foundation, for including our donors and our board members, and we really look forward to working with you to tell this story to more and more people. Thanks.
See what I mean? Okay, what an incredible partnership this is going to be. So now it's my pleasure to introduce Dean Miner. Dean Miner has inspired us with his vision to lead the biomedical revolution in precision health, and he has really provided a roadmap for all of us here, both at the Maternal and Child Health Research Institute. We think about this goal, this vision of helping to predict, prevent, and cure the health conditions that impact the lives of countless mothers and children every day. And as we review the grants, it's so clear to us how everything that we're doing at the Maternal and Child Health Research Institute is so perfectly aligned with that vision. Dean Miner.
Well, thank you, Mary, and good morning. I certainly agree that this is the most exciting place to be. I had an opportunity to peruse some of the posters that are going up in the foyer outside in the room next door, and it's just amazing the work that's being done. So congratulations to all of you. Now, when we dedicated our mission and defined our vision in precision health just a few years ago, it was to impact the people of all ages. But nowhere does this vision feel as appropriate as in the case of the health and well-being of expectant mothers and children. The ability to predict and prevent disease, as well as to cure disease precisely when it does occur, can save lives and improve the quality of life for the most vulnerable of our patients. Which is why, in a very real way, the full weight and muscle of Stanford medicine is behind the effort in pediatric and maternal health, as you're going to learn about today. It starts with the magnificent new hospital, which embodies holistic, high-tech, high-touch care in a way that meets the need of every patient and his or her family. It incorporates the latest technology of today and also will incorporate the emerging technologies of tomorrow. And most importantly, it embodies the body and the soul of what we want to convey and deliver in compassionate, caring, and very much integrated care in an environment that reduces the stress inherently associated with the illnesses that lead children to receive care at the hospital. Now, precision health continues with the work of Steve Quake and his team here at Stanford, who led a multidisciplinary effort that developed a blood test that can accurately predict premature birth, one of the leading causes of infant mortality. That, of course, follows on the heels about a decade ago of the work that Steve and his colleagues did to show that the karyotype of a fetus can be determined from a simple blood test in the mother, thus thereby almost eliminating the need for amniocentesis. We also see this vision of precision health through a joint program between the Moore Children's Heart Center and the Clinical Informatics Fellowship Program, which is using a mobile app that helps to monitor infants who have single ventricle heart disease. Parents upload vital data from their home directly into the patient's electronic health record for their care delivery teams to monitor. This innovative program takes high-tech, high-touch digital health and delivers leading-edge care, allowing families with seriously ill children the comfort of being at home where everyone really, really wants to be, and yet being at home and still having the safety of the type of monitoring that this system offers. And we see this vision of precision health when it comes to curing diseases precisely in the many programs that we've begun here recently in cell and gene therapy. And just to give you one example, and many of you have read about this example, and some of you I'm sure have met the people involved, but young Salvador de Leon has a particularly difficult variant of leukemia, for whom chemotherapy and a subsequent stem cell transplant failed to slow the progression of his illness. A month later, he received CAR T-cell therapy, and we're happy to report that many months later, he remains free of disease. Now, these are just 3 examples amid a multitude of others that show how this vision of precision health is having an impact on the health and well-being of expectant mothers and children. Because of your work, I'm truly heartened and humbled about the future. And I know that this is the place, because of you and your work and the amazing leadership we have here, that is going to have profound impact in the health of expectant mothers and children for decades to come. So thank you all for your work. I look forward to learning more this afternoon in the speed dating session, which I think is going to be interesting for all of us to see how that goes. But thanks a lot. Mary?